Good evening, everybody. My name is Dr. Victoria Novak, and I am based out of the United States. I took the NAVLE about 5 years ago in Missouri. I'm currently working as a full-time swine veterinarian in a mixed animal practice uh, in Iowa City, Iowa. So excited to be working with all of you. I have my email attached on the slide. If you have any further questions, feel free to reach out if there's anything I can clarify. But today, for your first intro to NAVLE lecture, we're going to start with pigs. And specifically, we're going to be looking at diarrhea in pigs. And just for your guys' reference, pigs make up a very, very small section of the NAVLE. You definitely want to go in prepared, but just kind of keep this in mind as far as your energy and your focus goes. There will maybe only be a handful of questions on these swine diseases and diarrheal diseases. So hopefully you get what you can out of this lecture. And like I said, feel free to message me or email me if you guys have any questions. So with that, I'm going to start here. So a lot of the diarrheal diseases in pigs are very age specific. So in my work as a commercial swine veterinarian, these ages are usually broken up by location. So baby pigs are usually on a sow farm. The sow farrows gives birth to the baby pigs, and they're in that sow farm for about 3 weeks until they're weaned. After weaning, they either go straight to a nursery where they are there for 3 to 8 weeks. They can also go to a wean to finish building where they are growing out until slaughter. But if it's just a nursery phase, then they're there for 8 weeks, and then they transition to the grower finisher. And they're there for the next, 8 to 17 weeks to finish growing out until they're the correct size for slaughter. So when I get a call about sick pigs, it matters if I'm going out to a sow farm or a nursery or a finisher, because I'm going to be thinking about different kinds of diseases. So from the standpoint of NAVLE, you can, memorize the dates and times that animals might get these diseases, or you can kind of break it into these chunks, and that's how I'm going to try and lecture it to you. The other thing I wanted to just run over really quick with you guys is antibiotics. NAVLE isn't going to specifically ask you, hey, it's this disease, what antibiotic are you going to go grab? But from a practitioner standpoint, what I want you guys to keep in mind, there's long lists of drug names for possible treatments, but you are always going to be working with what's on label and what makes sense for those pigs. So if I'm going into a sow farm, there's only 3 antibiotics that I'm going to reach for if a baby pig has scours. And you guys do not need to memorize these. I just wanted to kind of for you to have this information so you have it in context so that nothing's overwhelming. There's only going to be a couple things that you go for in each of these locations. But again, if I'm treating a baby pig, I'm going to gravitate towards different types of antibiotics than if I'm treating a full-grown finisher pig. The other thing I wanted to point out is that there is actually some antibiotics that you do use across all age groups. And so again, don't let it overwhelm you how many options for antibiotics there are when you are out in practice. You only have a handful of things in your toolbox anyway. So we're going to start with neonatal diseases, neonatal diarrhea in piglets. So when we're talking about diarrhea, You are going to see small, thin, dehydrated, poor body condition piglets. They are usually hypothermic, they're piling, they're huddling, and diarrhea can be a primary cause of mortality, but it can also cause them to become hypothermic, weak, and they can get they can die for those secondary reasons from not, being able to make it across the crate to nurse and get that nutrition. And in all honesty, most of these scours are really controlled by cleaning and disinfection and our vaccine protocol. So most of these scour issues don't tend to be an issue if you can keep the farrowing crates clean and dry. You're all in, all out. You're not having old piglets and young piglets next to each other in the same location. If you can put a similar age group of piglets all in one spot into clean, dry crates, you usually don't have a lot of these scour issues. The other part of this is if you do have a continual scour issue, the best thing you can do is get a vaccine into the mother. Because a lot of these diarrheal diseases kick in within the first couple of days of life. There's no time for a vaccine to the piglets to be effective. So what we do is we actually booster the immunity in the mother in the 1 to 4 weeks before she gives birth, because those antibodies that she makes gets put in her milk, gets put in her colostrum, and that's how you protect these baby pigs from that early diarrheal challenge. The other part of this, like I said, is day one care. Day one care is how we talk about taking care of those newborn animals on the farm, making sure that it's not too cold in there when they're farrowing. Brand new baby pigs cannot temperature regulate, and so they are dependent on us to create an environment where they are not getting overly chilled, overly wet, because that will set up a scour challenge. Scour is an American word for diarrhea. I don't know if that's an international word, but I'll use that interchangeably with diarrhea. But the thing also to remember about these neonatal diarrheas is you can see them within a couple hours of farrowing. So that pig, when it's born, it's usually there with the mom from the minute it's born to about, 3.5 weeks. A lot of these scours can float around in that time zone, but they can absolutely be there within a couple hours of birth. So from a NAVLE perspective, when you think about a brand new baby pig on the ground, there's 5 diseases you kind of have to just keep in your mind. I put rotavirus at the top of this list because from a clinician standpoint, a lot of these bacterial diseases end up being secondary to the viral challenge. A lot of these infections from a clinical standpoint are mixed infections, but from a NAVLE perspective, we have to tease them out a little bit more than that. But I just wanted you guys to kind of keep this context. So first off, rotavirus is a virus. Many species have rotavirus. Humans have rotavirus. It's not the same strain of rotavirus. We do have species-specific strains. It is possible for this one to be zoonotic, which means it can infect people. But typically it's on the species-specific side. I just wanted you guys to kind of be aware that that exists. The window of symptoms for rotavirus is a little bit broader than some of the other bacterial diseases. When I walk into farms, I'm normally seeing rotavirus between 3 to 5 days of age is when I tend to see it flare up. But it can be there day 0, and it can still be there at weaning. But from a NAVLE perspective, just kind of keep in mind that that's one of the things that can show up. I don't have a lot of success looking at diarrhea, knowing exactly what it is, but rotavirus is going to be on the more watery side. You can do crate side litmus tests to see that it's a more of an acidic diarrhea, but really you're going to need to rely on farm history and diagnostics to tease this out. Rotavirus does impact the small intestine as primary source of action, and it's going to damage those villi. It doesn't tend to kill piglets. It doesn't have a very high mortality, but it does stunt growth because of that long-term intestinal damage, and pigs just don't absorb nutrients as well. They don't grow as well. So you can look into a rotavirus crate and you can see a pig that's this big and you can see a pig that's this big, depending on how that rotavirus impacted those piglets. because it's a virus, antibiotics aren't going to treat or cure or prevent the infection. We normally do use antibiotics just because, like I said, you get secondary bacterial infections. So you're just trying to prevent those secondary infections from kind of compounding on the initial rotavirus challenge. As far as supportive care, like I said, keeping the environment warm for the piglets so they don't get too chilled and hypothermic. As well as sometimes we'll do creep feed, milk powder, electrolytes, something like that, just to kind of nurse the piglets through this diarrhea. And again, like I said, there is a vaccine. We never give this vaccine to piglets. This vaccine is going into her mom because we want those antibodies in her milk, because at this day 0, this is when that piglet's getting that challenge, and that passive immunity from the mom's milk is what's going to protect them from this kind of scour. Clostridium perfringens is also a common bacterial infection we see in the crates when we're looking at newborn baby piglets. I put them together so that you guys can kind of compare them. The more aggressive, the more pathologic of the two is type C. This tends to be a more bloody scour. If you do a necropsy on the piglets, you'll find blood in the small intestine, and you will see a higher mortality with this type C. Window of infection is early, that 0 to 3 days. And honestly, it's going to be stuff like the room's not clean, the sow doesn't have good milk. There's going to be something that kind of tips them into this type of infection. You can treat with antibiotics, but like I said, you're behind the curve if that's what happens. There is a vaccine for this. Again, same as the rotavirus, that vaccine is going into the sow so that the antibodies end up in her milk. Type A Clostridium perfringens is also relatively common, especially as a secondary bacterial infection. More on the creamy side instead of the bloody side, still acting in the small intestine. And on necropsy, you'll find a little bit more gas in the intestines than in compared to the type C Clostridium perfringens. You can also see E. coli in those early ages. We call it colibacillosis at this age. Again, usually a secondary thing unless you're having a really bad hygiene issue. Still that 0 to 3 days. Still acting in the small intestine. The only thing that sets us apart a little bit is that the diarrhea is more alkaline than acidic. And again, you can treat with antibiotics, but you're a little bit behind the curve. Gentamicin, Spectogard are kind of our go-tos. And the only other point I threw on there for you guys, this is gram negative. It's not so important that you absolutely memorize E. coli as gram negative, but just kind of keep in mind that that's going to affect what antibiotics you choose. Be thinking about, this is a gram-negative pathogen, therefore I need to pick an antibiotic that has a gram-negative spectrum of action. NAVLE questions, like I said, aren't so much, here's this, what is this? They'll kind of give you a couple facts and clues about what kind of case this could be, and then ask you, what kind of test might you run? What kind of antibiotic would you not want to grab? They're kind of looking at broad categories more than exact facts. So again, you don't need to necessarily memorize that this is a gram-negative bacteria, but just keep in mind that that might impact your antibiotic choice. We do have vaccines for E. coli. We have an injectable form that goes to sows. But hang on to this thought because this is a type of scour that does actually show up down the road as well. So just hang on to this one for a minute. The last one in our kind of day 0 early world view of piglets is Clostridoides difficile. Again, gram-positive, intestinal. This shows up a little more in the colon. If you do necropsy on these piglets, you'll see that mesocolonic edema, just that fluid, that inflammation kind of rushing more to the colon. Diarrhea is more on the watery side. This one can maybe go a little bit longer in life than the Clostridium perfringens. Those were 0 to 3 days. This is more 0 to 7. But again, this is also a vaccine that we can give to the sows to boost that lactogenic immunity. Okay, and so here we're going to switch gears a little bit because those 5 pathogens we talked about were kind of our day 0, first couple days of life. Now we're going to talk about coccidiosis, and that's the transition from the others to coccidiosis are my 2 pictures here on the left. That newborn baby pig is not going to end up with coccidiosis. Coccidia is a protozoa. It takes a little bit more time for it to grow and establish infection and lead to pathology. So the little baby pig on the left is too small to have coccidiosis. When you get over to that 7+ days of age, that 7 to 21 days before they get weaned, is more the pigs I'm looking at when we're talking about coccidiosis. Again, coccidiosis is in a number of different species, including humans, but tends to be very species specific. So the swine species of coccidia is Aethosporus suis. And this absolutely does appear as a more pasty diarrhea. So again, in comparison to those other, viral bacterial diseases, you are going to be looking at older pigs with a pastier disease or a pastier scour. And your brain's going to start thinking about coccidia. As you can see, rotavirus is still on this list. It can still be there. But like I said, we're talking about watery versus pasty. And again, neither of these tend to kill the piglets. There's not a high mortality with these diseases, but it definitely stunts their growth and impacts their growth and their health post-weaning. Coccidia is, again, more a little bit in the small intestine, long-term damage to those villi and crypts. Instead of an antibiotic necessarily, we're looking at antiprotozoal medication. So panazeral is kind of the gold standard for this disease. Okay, so now we're going to switch. So far we've been thinking about sow farms. We've been thinking about those newborn piglets, that first 3 weeks of life, they're still on mom. When we go to weaning, they're having a diet change. So they're moving from milk to solid food. They're in a new environment. It stunts their immunity. They're in a stressful environment. Post-weaning scours are very, very common. But there's 2 scours that really stand out as the most important if somebody's calling me about diarrhea in their newly weaned piglets. When I say 2, I'm kind of talking about 1 because, again, I said E. coli would come back up. E. coli comes back up. So E. coli is a normal inhabitant of our intestines, pigs' intestines. So in those first couple days of life, like I said, cold, poor milk, dirty crate, those things can kind of turn into E. coli in the early stages of life. But when you move to the nursery, E. coli turns into a big, bad outbreak infection that can have lots of dead pigs. So there's 2 types of E. coli we really worry about. The worst one of the 2 is F18. F18 is actually the name of the toxin that's produced by E. coli. So when we send off E. coli samples to the lab, we kind of have to ask for a pilus type, a genotype, to figure out which toxins are being are part of that E. coli and causing the symptoms that we're seeing. So with an F18 E. coli, it's very watery, but it gets more severe than that. You can have 60 pigs drop dead in a day with F18 E. coli. It works that fast. It's that pathogenic. I've got a really good picture over here on the right, those bright red intestines. Intestines like to change color, but if you cut open, 4 or 5 pigs and they've all got that red or dark purple color in their intestines, you're absolutely looking at E. coli and probably an F18 E. coli. F18 is also called edema disease because of the sheer amount of swelling and inflammation, and that's that's wateriness in the intestines, but it also shows up all over the body. You can see the pig on the bottom of the page here has that swollen eyelids just from that sheer infection. There's water in the eyelids, there's water in the lungs. You can even see some shagginess, swelling of the back legs. And that's just from the sheer inflammation that this toxin is causing with this F18 E. coli. The other type of E. coli we look out for is called K88. This is definitely less severe, but can impact the immune system of the pig. You can have some death loss of this pig. It's just maybe you're losing 10 pigs a day instead of 60 with the F18. And again, with swine medicine, your best bet is always prevention. It is expensive and inefficient to be throwing antibiotics at these pigs. If they get sick, that's what we have to do to try and save them. But you are way better off cleaning, disinfecting, power washing the nurseries before these pigs get moved into them, and administering vaccine. So in this case, with this E. coli that we're talking about in nursery post-weaning, this is a vaccine that we actually do give to the pigs. And this vaccine is typically an oral vaccine that they drink through their water. You can put it in a water medicator and run it through the water to the whole building, or you can pick up the pigs and put a dose directly in their mouth. Here I have an actual case from a food animal susceptibility from a scour case. This is something Natalie might throw at you. This case grew both E. coli and salmonella. And then on the left-hand column here, we have a list of antibiotics. So as clinicians, you kind of have to read through this and understand when you're looking at when you're seeing resistance in these bacteria, because it absolutely impacts your decision on antibiotics. If E. coli was susceptible to everything, I could use gentamicin, I could use Exceed, I could use enrofloxacin, I could use norfenicol, I could use 4+ types of antibiotics. Generally, the E. coli we see out in practice might be susceptible to 1 or 2 of those. So I could treat 100 cases of E. coli with gentamicin, but if I go to the next farm or if I use gentamicin for too long, that E. coli can develop resistance. Now gentamicin isn't going to be effective anymore, and I'm reliant on the laboratory to tell me which antibiotic is going to be most effective for these pigs. Okay, and that kind of wraps it up for the young, newborn, early wean pigs. What we're going to jump into now is the bigger pigs, growing, finishing pigs. And honestly, these guys are pretty resilient. They're not as susceptible to environmental changes as the newborn pigs are. You can still see some diarrhea start from, bad feed, poor water quality, or overly cold temperatures. But these guys tend to hold up a little bit better in the face of those challenges. So again, kind of my top 5 categories, top 5 diseases I'm thinking about if I'm getting called out to a finisher where I know it's older pigs. These are the diseases that I'm going to be thinking about holding in my head. The first disease, very, very common, ulcers. Ulcers are usually a condition of the environment, not a primary active pathogen. So most commonly I see ulcers, honestly, with influenza outbreaks. Pigs get flu, they have fever, they don't feel good, they go off feed, they stop eating, and that stomach acid kind of eats away at their stomach lining and can turn into these ulcers. And if ulcers get severe enough, usually if you've got an ulcer problem in pigs, you don't think, oh, that pig's got an ulcer necessarily. Usually what you see is a dead pig. And if you walk up to a dead pig and it is bone white, no pink, no rosiness, no inflammation, you just have a sheet white dead pig, you can look at that and think that's probably an ulcer. Because the problem with ulcers is that they start bleeding through that lesion in the stomach or in the intestines. They're leaking blood in their GI system and ultimately die from that. And again, like I said, that's usually from being off feed. Could be from flu, could be someone forgot to turn the bin on. They didn't even have feed. The other thing that can cause this too is that if the farmer producer was over grinding the feed, and the particle sizes got too small, too fine, and that can eat away at the stomach lining as well. So I'm pointing this out as a grower finisher thing. It can be in any ages, but this is more typically where we see it. When you're looking at diarrhea, like I said, you usually just see a bone white drop dead pig. But if you're seeing scours and it's this bloody, if you're familiar with melena, right? Melena is when blood is higher up in the intestinal tract and it's making its way through the digestive system. By the time you see it as diarrhea, you're looking at dark digested blood, very sticky, very tarry. So pre-death, that's what you'll notice in an ulcer pig. Treatment, it is really hard to say these guys, turn them around. You have to make corrections to the environment. You have to correct their feed if the particles are too fine. You have to get them back on feed if they're sick. You just kind of have to accept that that's something to watch for. Ileitis, or proliferative porcine enteropathy is the other name for it, but we almost exclusively refer to it as ileitis. Is caused by a bacteria, Lawsonia intracellularis, and this is a big problem in finishers. This is something we routinely vaccinate the piglets for to kind of give them that protection in the finishing barns. Lawsonia is a gram-negative anaerobic pathogen. Again, just keep that in mind, thinking about what kind of antibiotics you would use on a gram-negative pathogen. You can see ileitis in older ages, as young as 3 weeks, but not super commonly. You're really going to see this in older, bigger pigs, almost to the point where the vaccine they got as a piglet is starting to wear off, is usually where we see this come in. And again, this Lawsonia causes bleeding in the intestinal tract. So similar to an ulcer, you'll see that melena, that dark tarry stool. But the other side of Lawsonia intracellularis is that this can be a subclinical infection. And so at that rate, you won't necessarily see the same number of deaths. You won't necessarily see that dark tarry stool, but you just have these fall behind, skinny, too small pigs. And again, it can kind of pick and choose throughout the barn. So if you're looking across a barn full of, market age hogs, you'll see nice, big, good ones that are ready to sell, and you'll see itty bitty, bony, scrawny ones that are nowhere near ready to sell. And that's this bacteria, that's this pathogen taking a toll on these pigs. And so fortunately, it is pretty responsive to antibiotics. So a lot of producers, if they know they have an issue with this pathogen, this is where they might add something to their feed protocol. They can say, they get pigs about every 9 weeks. And so they say, man, I have this problem group after group after group. They can proactively put antibiotics in their feed for, this week, for this month, for this age frame, where they know they tend to have this issue. So lincomycin and tilvalosin are the top two for this one. Like I said, that's in the feed. These are also water medications. So if you're having an acute issue, an acute challenge, their barn's falling apart, you can run these antibiotics through the water instead. But like I said, antibiotics are your best bet for this one. And this one is interesting because we have 2 types of vaccines available for it. It can be an injectable killed vaccine. We also have a live oral vaccine that you can run through the water. So if the piglets aren't injected with the vaccine when they're young, they can move into the finisher, and that producer can choose to run that vaccine through his water and vaccinate the pigs himself. Salmonella, another one that kind of shows up around weaning, again, kind of that drifting towards older age. Anaerobic gram-negative bacteria. And again, this one is absolutely zoonotic. So keep that in mind. Tends to be a more watery diarrhea. You will see these pigs dehydration, off feed. Yeah, on necropsy, you kind of get this necrotic debris, these necrotic films in the intestines. They show up like this picture as these like button ulcers. And the problem with those ulcers too is that as they kind of grow, as they coalesce, as they merge, they can actually bind pieces of the intestine to each other and form these rectal strictures. So after the initial bacterial challenge, you can still have death and mortality if you ended up with some of these rectal strictures that mean pigs can no longer pass feces, and they end up dying from that. Again, usually pretty responsive to antibiotics. Neomycin is kind of the go-to for this one. But again, definitely worth sending out to the laboratory for bacterial culture and getting an antibiotic susceptibility on this type of disease. And fortunately, we do also have a vaccine for salmonella. This is also one of those oral attenuated vaccines. Swine dysentery, another classic swine disease. I would say less and less common now. Brachyspira hypodysenteriae is the pathogen that causes that. Again, anaerobic gram-negative bacteria. Diarrhea tends to be more yellow-gray. This diarrhea will be a little bit more mucousy. Again, kind of focused more in the colon of the pigs. Colon is a little bit more watery in its contents. Still those membrane patches on it, so very similar to salmonella. So something that is definitely worth sending to the lab to help differentiate between these two pathogens. And again, this one is very responsive to antibiotics. There's a pretty long list of things that are labeled for it. And again, these can either be run in the water or in the feed if you know you have these issues at your site. And I don't believe there's a vaccine available for this one. There's not one being marketed currently. That may just because it's decreased in frequency. The other thing we have to keep in mind for swine scours, if you get called about diarrhea in pigs, are parasites. This is less common in conventional systems, but if someone is raising pigs in their backyard or on dirt patches, you still have to keep this in mind. So the top two we kind of look at are Ascaris suum and Trichuris suis. I briefly kind of went into the life cycle of these. Both are just the infection is transmitted by ingesting eggs. So it's contamination of the environment. The pigs are ingesting these, like I said, more often in dirt than when we've got them in confinement in buildings. The main difference between the two is that Ascaris suum tends to migrate. So those eggs hatch in the intestines, and then the larvae move throughout the body and can end up in places like the lungs and like the liver. So instead of straight death, what you'll see with roundworms is, yes, diarrhea, but also that poor growth, those uneven pigs, your nice big pig and your small, skinny, bony pig that's just not doing as well. And if you get to the migration point of these diseases, the pneumonia, the coughing, that wet, hacking cough, can ultimately be from these worms in the lungs. Or if you're seeing jaundice, that could be, that larvae buildup in the liver itself. So on necropsy, you can tend to see evidence of these worms in the intestines. You can tend to see those spots in the lungs, and you can absolutely see those lesions in the liver. Again, fairly easy to treat. Fenbendazole is a pretty broad spectrum dewormer that will work on most roundworm infections. You do have to keep in mind timing of deworming. you need to kind of suss out where that infection happened, if it happened when those pigs were placed at that site, or if they picked it up from another site and brought it with them, because environmental contamination can lead to recurring infections down the road. So doing what you can to mitigate that environmental risk, and possible multiple dewormings over time might be necessary with chronic roundworm issue at a farm. In comparison, the whipworms don't tend to migrate the same way that the Ascarisum migrates. These latch on to the walls of the cecum and actually drain blood. And so with the Trichuris suis, you more commonly see that anemia from that blood loss in the intestines, but instead of necessarily seeing that melena, it's getting digested and eaten by the worms. So dehydration and ultimately death are what you will see with these pigs over time. Again, pretty responsive to fenbendazole and most common dewormers. Here's just a couple of pictures of, this is specifically Ascarisum, so not the whipworms, not Trichuris suis. Evidence of the worms themselves in the intestines, as well as those milk spots in the liver from the migration of the larvae. So this is kind of a fun necropsy to do. Like I said, not super common in conventional pigs, but if you've got somebody who's raising pigs outdoors, you cut them open, you see that liver, pretty pathognomonic for that Ascarisum infection. Okay. And then finally, the last two I wanted to touch on for diarrhea in pigs, I call the big bad diarrheas. For these two viruses, throw out everything I said about ages. These diseases can hit anyone, anywhere, anytime. Most of our swine confinements are shower in, shower out. We put a huge emphasis on cleaning, disinfecting. A lot of our farms even have UV chambers to kill viruses, because these diarrheal diseases are so bad when they get into a farm. We do everything we can to prevent them from entering our system. They are highly contagious. They persist really well in the environment. In the US, we are entering disease season. We are going into winter. It's getting colder outside. Those colder temperatures preserve these viruses a little bit better than in the middle of heat with summer. So we see these outbreaks happen a little more commonly in the winter because these viruses survive outside for longer. So swine veterinarians are really good about naming things what they are. So we call these diseases PED and TGE. PED stands for porcine epidemic diarrhea. TGE stands for transmissible gastroenteritis. They are both coronaviruses. And the really interesting thing about these two diseases is that PED in the US showed up in 2014. We didn't have this disease prior to 2014. So in 2014, the number of tests for TGE, for that transmissible gastritis, went through the roof, because everybody was getting these new cases. They're like, it looks like TGE. So they were submitting samples and everything was coming back negative. Since the PED outbreak, we have actually seen less and less and less TGE. So the biosecurity measures we've adopted, we still fight a little bit of PED. We still see some outbreaks a couple of times a year. TGE has not been seen in the US for the last 4 years. And I think that's because of these PED outbreaks and the increased biosecurity to prevent these outbreaks. But driving home that point that these two diseases are both coronaviruses and they look really similar, but if you test for one, the other one's going to be negative. So for PED and TGE, when they get into adult pigs, usually don't cause mortality. You will absolutely see diarrhea. You don't see the fall behind and loss. It's usually pretty transient, maybe about a week of symptoms. But you can see vomiting in these pigs and, just being off feed, lack of appetite. Where these are truly devastating are when they get into a sow farm with newborn baby pigs. Because if a brand new born baby pig picks up this virus, they become incredibly viremic and they shed virus and they shed virus and they shed virus and they die. And because it's so contagious, on a sow farm where you're having pigs born every week, those pigs that get infected are shedding so much virus that every pig that's infected dies. So this is a horribly traumatic disease when it gets into those newborn baby pigs, especially if you're on a farm where newborn baby pigs are being born on a continual basis. So if this gets into piglets, you walk into a barn and you think, oh my goodness, this is PED or this is TGE. It's because you're seeing scours, you're seeing thin pigs, you're seeing them pile, but you're also seeing just pigs die everywhere within 24 hours of becoming infected. So with this disease, again, we've leaned on prevention is way better than trying to manage it over time. So what we normally do on farms is we attempt to eradicate this disease. So to do that, what we have to do is we normally break the cycle of transmission by euthanizing at least 2 weeks of piglets. Newborn baby piglets, before they have a chance to become infected, before they have a chance to spread viremia everywhere, we euthanize them. We get we vaccinate all the sows. We'll do feedback. We'll take that diarrhea from the piglets, we'll give it to the sows because they're able to mount an immunity and again put that immunity in their milk. And so by doing this, by boostering the sows, getting their immunity up, and giving the farm a break from baby pigs that are going to spread virus everywhere, we deep clean, disinfect, and then in 3 weeks, we'll start having newborn baby pigs again. And if you did your job right, this disease could just be gone. So again, it's usually so drastic, it's usually so fast. Live virus exposure is how we manage this. There are vaccines out there, but hopefully you're doing a good enough job with biosecurity. Not all farms choose to have this in their vaccine protocol all of the time because we're relying more on our biosecurity than the vaccine to try and prevent this disease. But in an outbreak situation, you can go through and vaccinate the sows to try and boost up that immunity and get the farm back to healthy. Okay, all right. And with that, that covers our dirty dozen of swine diarrheal diseases. I will take questions if anybody has anything. These slides, I believe, will be made available to you to read through on your own. And again, if you have any further questions, please feel free to email me if there's anything I can clarify for you all. Yeah, I appreciate your guys' time. And like I said, feel free to message me. You can put something in the chat. You can message me later. Let me know if there's anything I can clarify for you guys. Yeah, Dr. Kumar, I can go ahead and address that for you. It really depends on the site and depends on what kind of worms you're having an issue with, whether it's kind of that Trichuris suis or Ascaris sum. Normally in a conventional building, we will deworm our gilts. So if you're introducing new animals into an existing farm, pretty good idea to deworm them before you mix them in with everybody else. After that, we typically don't have to deworm piglets through their finishing phase. If it's an outdoor system, that's definitely a different situation. At that point, I would say probably waiting about 2 to 3 weeks post placement. There's no sense in deworming the piglets right when they arrive at your site because they shouldn't be infected at that time. But after they've had a chance to pick up stuff from the environment, good idea to go ahead and deworm at that time. From there, it kind of depends on the burden in the environment, but maybe just one other deworming should be necessary before you market those pigs. So something that we're definitely strategic with, doesn't necessarily have to be a routine. thing if you've got the introduction of parasites under control, if that makes sense. Yeah, great question. Um, so our typical recommendation is to add something with more fiber. So rolled oats is kind of the easiest thing for us to grind up. In the States, most of our swine feed is corn and soybean, high protein, high calorie, very low fiber. So getting some rolled oats, a little bit more fiber ground into that can help short term. They're very expensive, so we tend not to do a whole lot of that super routinely. Um, the main thing we kind of rely on are electrolytes. So we will add electrolyte solutions to the water to kind of help get them that nutrition to get them through the diarrhea. All right, again, thank you so much for your time. And if you guys think of anything else in the future, don't be afraid to reach out.